So it's week 2, time for some updates. First biggest update, my voice. I've lost it. I got some laryngitis, got an upper respiratory infection. Starting to feel better now, but so this is probably as good as it's been right now, so that'd be good to give you guys some updates about what's been going on with my week. So been on the wards on like Monday and Wednesdays, and then been with physiotherapy or PT on Tuesdays and Thursdays. You see me wearing a white coat here. I know in Loma we don't often wear a white coat, but here to identify the doctors is much easier for them to have everybody have a white coat on. So we're going to go to physiotherapy so you can a little bit see about the gym, see what that looks like. Thursdays is usually pediatric days. Tuesdays is the days that we have adults, but it's not uncommon for them to mix and match. We're in the Annex now, somewhere I've been for the last couple of weeks, and I want to introduce you guys to somebody. This is Maggie.
My name is Maggie Montari. I'm a physiotherapist here. So here at Malamulo, we see a variety of conditions, from inpatients to outpatient. But here at Annex, we mainly see outpatient clinics. So we run outpatient clinic days, and this is the place where we work. So we do pediatric conditions from cerebral palsy, arthrogryposis, fractures, contractions, and everything associated. And in adults, we also see patients with cerebrovascular accident, orthopedic conditions, musculoskeletal conditions, and pre-op patients, especially for functional assessment. So maybe I can show you around where we do our outpatient clinics. So this is the setup where we work for outpatient clinics. We have two treatment tables for this one, and here we use mainly for stroke patients and pediatric conditions. We have steps if you want to train patients for steps. We also have our treadmill there for good training. We also have a bicycle, and of course also this one here. And here is our manual tilt table. We have our parallel bars for good training. It really helps a lot with stroke patients when we want to train on how to start ambulation again, and walkers as well, and crashes. This is our TENS machine. We have a small portable ultrasound machine, a mirror for visual feedback.
Thank you so much. Thank you very much, Maggie. Appreciate it. So I wanted to also talk about some other equipment they have here, which is some ankle orthotic devices as well. They have a few stored here, similar to wheelchairs or crutches that we mentioned earlier. These are things that are loaned out and then perhaps returned just because there's limited supply here. But they do have some of those. We're only waiting for one of our patients to arrive, and this brings up a good point. So here, there isn't exactly a grace period that you might find in the United States, and that's because of a few different things. One is regards to transportation. So transportation here is very difficult. So some people, depending on where they live, have to take multiple modes of transportation to get here because not everybody has a vehicle. And so that can include taking a motorcycle and then to a taxi or to a big van to here, and they can spend even up to, even a couple hours coming to here. Either that, or if some people are just walking from their other villages to here too. So people are pretty understandable and willing to wait, especially a lot longer for patients to come here. In fact, it reminds me, we had a patient earlier today who had syphilis that actually extended to his spine, and so because of that he was paraplegic. And when we had seen him, we noticed a couple different wounds on his feet and his legs, and we asked him from what that was from, and he said that when he was transported from the hospital back to home, he had to take a motorcycle back home, and when they took a motorcycle, or one of the rides was a motorcycle, when they took the motorcycle home, he, from the exhaust, had gotten some burns, but he couldn't feel it because of his the injury from the syphilis. And so these wounds were kind of old and healed and scabbed up. The next thing I wanted to bring up was adapted equipment here. So you saw some of the equipment there in the gym, which included some crutches, some walkers. Those are things that we have here. Most of the time, they're not necessarily loaned out to people in the community because, like I mentioned, some people live far away, so they may not be able to come back and return them. And we only have a limited supply. So often what people will do if they need some adaptive equipment is they'll go to a carpenter, and a carpenter will make some. So here's an example of one. So they'll make them these things, like a crutch here. We just talked to a patient earlier today, and we asked them to help make a couple different things. Number one, he could have benefited from a sliding board for transfer. So we had showed him a picture of it, the patient and his guardian, and we told him maybe to go to a carpenter to see if that can get made. We asked them to make a sliding board and then a commode for him that can be able to be built, or at least something, an elevated toilet seat that he can use over a toilet. So those are some of the challenges that we face, but then also some of the things that I think rehab really shines because we're really into being creative and innovative to try to find solutions to problems that people maybe often will deal with for years, and it can improve quality of life. So I am going to introduce you to some of our doctors here, and so we have here Laura Sherwin.
I am a dentist here, so I've been working at Malamulo here for about 3 years now, and we've had this dental clinic open for just over a year now. We came here as DMAs, Deferred Mission Appointees, through the Loma Linda and the General Conference program. And so yeah, we've been here. My husband's a surgeon here at the hospital, and so we wanted to do something together. We really felt God was leading us to be at Malamulo and to do service in this kind of environment, and so that's kind of how we came here.
What's kept you here?
Honestly, just really having the opportunity to be able to serve other people, and to be able to bring some joy to our patients, be able to provide a service that a lot of people can't otherwise get access to. We're providing it at a lower cost and in a more convenient location for people. They're already coming to the hospital for other medical care, and so to be able to offer another service, and in addition to be able to provide another more sustainable option for the hospital. Hopefully we can try and build up the dental program a little bit more and provide a sustainable option for the hospital to just generate a little bit more income for the hospital as well.
I've noticed some of the patients will stay here like kind of all day.
Yeah,
kind of just rotate throughout.
It's like the whole thing. I mean, they walk from very far distances to be able to come here to the hospital, and so they want to make the most of it. So they like to hit up the different departments based on what their needs are for that particular visit.
What's something that surprised you coming here, maybe being DMA or being here in Malawi?
In the United States, we work in a very fast-paced environment. My husband is a surgeon, myself as a dentist. It's all about the numbers, how fast can you see patients. Here, things are a little bit slower. It takes a longer time to get things done, get projects done. There's a lot of more follow-up that we need to do. But at the same time, we get to know our patients a little bit better. We get to know them, their families, talk to them. I don't feel the pressure of having to just produce all the time. I actually get to know my patients. I get to pray with my patients and just reach them on a different level than I would ever be able to do in the U.S. So here is the dental clinic. We're going to come in through the reception area here. And this is our waiting room area. And then this is the clinic. So it's a very small clinic at this point, but we have one dental chair here. And we have this unit here that allows us to do some cleanings and fillings and more complicated extractions. So that's been a new addition, so we're really excited about that. And then we also have a digital x-ray system here that we're using. And so that really, I think, takes us above and beyond what most other dental clinics have around here.
Hi, I am Pimpero Perry, that's my surname. The dental assistant here. I mean, a lot of tasks like dental assistant, like receptionist, and all that. I'm working with Dr. Laura here. She's very good. I mean, one of the best I've worked with. So here I do lots of stuff like paperwork here, and then when needed, I also get inside and then do other tasks with her during procedures and stuff. Yeah, it's really good working with her.